The Education Department has already found 300,000 fraudulent applications totaling $60 million in student loans. And one more thing, let's not forget about the Medicaid and the Medicare fraud. Administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Sir, the biggest thing right now is finding the fraud, and it's so plentiful that it's pretty easy right now.
We can find the fraud. There has to be a will to address the problem, which was lacking in the prior administration. And you have to have an all-of-government approach to actually taking charge and reducing the fraud. That's what the vice president is leading with the anti-fraud task force that the president created. He announced it in the State of the Union address. And you mentioned a $100 billion number. That's the amount of fraud we also think is happening within Medicare and Medicaid. But here's the catch. This is not going to students who are defaulting on loans. This is going to organized criminal endeavors, some of them based in foreign countries. So today, series of massive announcements to dramatically curtail this fraud. We're going to be clear with all the states. We want to have a game plan from you of how you're going to make sure that all the people providing services are legitimately able to provide those services. We're going to create a nationwide moratorium starting today that's going to slow down and cease new people from joining hospice and home health care. There's so much fraud in these arenas that we have got to catch up. We're going to allow people who currently have the services to continue, but no mas, no more. And then some big announcements for California. Unfortunately, the audit, the review of the financial reports that California has given us, we found wanting. We're going to defer $1.34 billion of payments to California from Medicaid until they prove that these accountings are legitimate. And we're also going to continue shutting down hospices in California. And remember, 1/3 of all hospices in the entire country are in Los Angeles. There are not that many people dying there. And we believe that half of those might be fraudulent. Today, we announced 800 hospices have been suspended, no longer were getting paid. That's going to save the taxpayer about $1.4 billion. So all this together, just today, in the task force that the vice president leads.
Yeah, well, what you guys did out there was actually magnificent, which is every government program ever has lacked this initiative, which is if you don't prove you're real, we're just going to stop your money. But the other thing, too, is these home hospice cares. We've been talking about this for a while. I've had you on to talk about it as well, that we don't even know if these people are going. Some of them are family members that are getting paid by other family members via government grants and things like that through these programs. And we don't even know if they're going. We don't know if they're qualified. We don't know anything about it. And they should just probably, if they're really that sick, they should be in hospice care, not in home.
Well, let me ask you a question for all the viewers. Is this a flaw of our system, or could it be a feature for some people, like governors in states who want to create jobs? And that's what we think might be happening in New York, where we have the #1 job of all in New York State is a personal care service worker, someone who, again, as you point out, is carrying the groceries upstairs for their parents. I mean, we have now created a jobs program that the federal government pays for. It means your tax dollars are going to pay for New York City and New York State people to hire their kids to carry groceries or drive them to the doctor's office. And then add to this, they're getting unionized now. So now you're creating a political patronage model that is going to be scaled around the country. The president says, no more, we're not going to allow this. We're going to get under the hood and look at the accounting, and we're going to force you to tell us the truth about where this money is actually going.
Sir, I thought you said that the #1 job in New York was in-home hospice care, in-home medical care. Did I hear that right?
No, it's in-home care, not hospice. It's personal care services. So hospice is the end of your life. When you're going to die because you have, for example, cancer. By the way, in California, all these hospices, these people aren't dying because they don't actually have lethal end-of-life problems. They're being tricked. And then in New York, we have the same thing, by the way, is happening with personal care services. This is designed to keep you out of the hospital or out of a nursing home, but you're not dying. You're just not feeling your best. But in New York, the rules are so lax that anybody can ask for one, and that's why we've seen weaponization of this tactic. Initially, well-meaning, help people get the groceries up the stairs because they can't do it themselves. I get that. But it's not a jobs program for your kids who don't have a job.
Yeah. The #1 job in New York is in-home care. I can't get over that. Dr. Oz, we appreciate it. Thank you for cracking down on this. Stay on it.
God bless.
He loves the Constitution. He fights for what's right. He hates the bad guys. He's a freedom warrior. He's your freedom warrior. Watch Carl Higbie every weekday on Newsmax.